Welcome back to another episode. Today, we're talking about something that can honestly feel a little intimidating for a lot of people. We're talking about how to help the youth of the church with their mental health, and more specifically, how to better understand what to avoid saying and doing while showing up with love. I often get asked by friends, family members, church leaders about mental health. And a lot of the phrases that I hear from people are, I'm just afraid I'll say the wrong thing, or I don't want to make it worse, or I don't know enough about mental health to help. And honestly, you're not alone. There's a lot of people that feel this way. But the good news is you're not expected to be a therapist. You don't need to diagnose someone, you don't even need to fix somebody. What is expected and what actually helps the most is much simpler than you think: listening, empathy, love, and helping the youth feel seen, safe, and included at church. Today, I want to walk through what actually helps youth that are struggling with their mental health and what intentionally hurts, even when our intentions are good. So here's three ways that you can support youth mentally and physically starting today. So let's start with what the church has given us guidance on about mental health. They've said mental health affects thoughts, emotions, behaviors, and relationships. When a young person's dealing with anxiety, depression, trauma, ADHD, or another mental health challenge, it can impair their ability to show up consistently, participate socially, meet expectations, or even do things that seem quote unquote simple to other people. And that can be confusing, not just for the youth, but for parents, leaders, and teachers who are trying to help. I love this. And one of the most important reminders that the church says is that mental illness is not a punishment from God. It's not a lack of faith. It's not something that can be overcome by willpower alone. That distinction really matters deeply, especially for our youth who already tend to internalize shame and blame. So let's dive into these tips. The first tip is to lead with empathy, not explanations. When a youth opens up, or even when you suspect they're struggling, our instinct is often to explain, reassure, or spiritualize something. But what they need first is to feel understood. So here's some examples of things you can do to communicate that empathy. You could say something like, I don't know what to say, but I want you to know that I care about you. Or you could say, you don't have to talk if you don't want to. I just want you to know that you're not alone. You could also say, I'm really sorry you're dealing with this. Or it's okay to have different feelings from day to day. There's no one right way to feel. Those statements don't fix anything, and that's exactly why they help. Now let's talk about what to avoid, even though these phrases are usually quote unquote well intended. We want to avoid saying things like, it's part of God's plan. At least it's not worse. Just focus on the positive. Serve more. Happiness is a choice. Just pray about it and go to the temple. Now, those might sound good, but here's why they're hurtful. They unintentionally suggest that the youth's pain is invalid, or a failure of faith, or something that they should be able to think their way out of. Imagine a 15-year-old already feeling broken, hearing that solution is to simply try harder spiritually. That doesn't bring peace. It actually brings shame. Empathy sounds more like, I believe you. This matters. You don't have to earn love by feeling better. All right, the second tip is to seek to understand, not to solve. When youth are struggling, adults feel this pressure to do something immediately. But the most Christ like thing we can do is often to ask gentle questions and just listen. Some helpful questions include, how are you coping right now? When you're having a good day, what seems to help? Or what kind of support feels helpful and what doesn't? Or who do you feel safe talking to? Notice what these questions don't do. They don't assume, they don't diagnose, and they don't push solutions. They invite the youth to be the expert in their own experience. And if youth don't respond, if they shut down, if they are uninterested in you, that doesn't actually mean you failed. The church reminds their leaders and members, don't be offended if your attempts don't seem successful. Sometimes your role is simply to be a safe adult presence, even if it doesn't look productive in the moment. And I love that because consistency matters more than you realize with kids. All right, the third tip is to normalize professional help and remove the shame. Youth in the church often worry, does this mean I'm not faithful? Or shouldn't prayer fix this? Or am I weak because I need therapy or medication? We can actually help by clearly and consistently teaching them that mental health treatment is not a spiritual failure. Medication is not a lack of trust in God. Therapy is not replacing the Savior. In fact, we can say things like, God often works through trained professionals. Getting help is a sign of wisdom, not weakness. You deserve support in all the ways that it comes. But there's something important to remember here. If a youth is really struggling and it's getting pretty severe, it is appropriate to encourage a mental health assessment from a qualified provider. You can involve parents, church leaders, family services if that's available in your area. And we must take any talk of suicide seriously. If you have a youth that's talking about wanting to disappear, seems like they're saying goodbye, they express hopelessness or despair, that is not something to spiritually reframe away. That is the moment to get immediate help through parents, leaders, medical providers, and even emergency services. Take it seriously, and you can save a life. One thing that you can do as a caretaker in this moment is you can dial 988, which is the mental health crisis line, and you can receive support and help to help that other person. You don't have to be the person in crisis to call the mental health crisis line. You can talk to that therapist on the other end of the line and receive advice on how to help this person or what might be best based on those circumstances. So I recommend everybody save 988 in their cell phone as the mental health crisis line, and you can always call it for advice and support, even if you're the one not struggling. All right, hopefully those tips were helpful. I want you to remember that helping youth with their mental health does not require perfect words. It requires a willing heart. You'll say things imperfectly. You will sometimes feel awkward in the process, and you may not see immediate results, but your efforts still matter. When youth feel loved, accepted, included, and safe, to be honest, they are more likely to stay connected to the church, to their faith, and to Jesus Christ. Your role is not to fix, your role is to reflect God's love through genuine concern. And that's more than enough. I appreciate you being here and listening to this and caring about the youth of the church and your willingness to learn. And I appreciate you showing up even when it feels hard. I would love for you to share this episode with other leaders, friends, family members who might need to hear this message as well. All right. Hope you have an awesome day.